Here at Kaweah Health, chaplains are really available to patients and their families and to our staff to be present. Some of my colleagues might say to be a non-anxious presence, to be someplace, something for someone so that we can be present to them in those moments of crisis, but also in those moments of joy and excitement, of celebration. And so I think part of our role is to hold space for people.
We're there to encourage and support whatever's going on, whatever level of care is needed. And so I love the fact that patients can call a chaplain for anything. One patient called me, "Can you come tell me a story?" Okay, I can do that. So just there to support, encourage.
Yes, we do go to rooms and we do pray for people. But sometimes I have a visit that doesn't even include prayer because that's not what the person wants. I have a patient that I meet with in hospice that's an atheist. So I've met with them multiple times and not once said a prayer. But I'm able to encourage, caregiving and encourage self-care for mom and allow her to look at things that help bring her support outside of that religious umbrella.
Every patient is a person with a story. And we at Kaweah Health value compassion, and part of chaplaincy is to be able to slow down and to spend time with the person. And every single person, no matter what your context or background is a person with a story to tell, a story to share.
I'm not here for religion. I'm here for you as a person, and it may or may not include religion, and that's totally okay by me.
We are here to help. We're here because we love people. We have our spiritual religious convictions that compel us to love people. We want to be of support and encouragement, and it's not simply a job that we do. This is a calling that we have, and we're seeking to fulfill that. And so we encourage you to take advantage of the services that Kaweah Health Chaplaincy offers.
We provide access to a chaplain 24/7, 365, and all they have to do is ask. And they can work through their nurse, or they can work through their physician, or they can ask their social worker, or they can ask really any staff member.
Not every hospital has a spiritual care department, and so we are very fortunate to be able to provide spiritual care and support to patients and their families, to our staff, as much as we are able to do. So we're super grateful. I'm glad that we have this service here at Kaweah Health.